injury. Now we do a process called muscle testing. Muscle testing is a foundation of what we're going to do with the kind of work we're going to begin to do now, working with her body. So the better we are at muscle testing, the more likelihood we are going to find a problem and correct that problem. So as we start this process, we're going to be very succinct about how we do this process. And as we start, at first, we'll be very slow with this, but as you get better with it, you get faster, more comfortable. It's like learning to play guitar. The first time you pick one up, you're not as good as you're going to be later on. Muscle testing is the same way. There's a little bit of an art to it, a little bit of a science to it. So start off easy with yourself and learn this process. And we'll do it enough times you'll be able to understand how it's going to work for you. Now, you're going to hear this throughout this presentation. When you work with 2 pounds of pressure for 2 seconds for 2 inches. And what I mean by that is we're going to actually work with a common standard system of actually testing this muscle every time we test it. And I'll show you what I mean by that. I'm going to ask Pam to bring it up. I'm going to ask her to drop her shoulder, lock her elbow. Now I'm going to ask her to meet my resistance for 2 seconds for 2 pounds of pressure for 2 inches. So I'm going to ask her to resist. Resist. Good. So at that point, I have a sensing of how strong she is and how, if I push pressure into her arm here, that weakness begins to occur. So I know at this point, this is what her system can deal with. Now, if she's bigger and stronger, I'd have to push harder, but I still want about 2 pounds of pressure for 2 seconds for 2 inches. A little child, you can do the same thing, but you can do much less, meeting that person's resistance as well. So you identify that specific person as how much pressure you can put until the system begins to break down. And once we feel that breakdown, we know now at that point that's how much resistance they can take. Because later on, you start finding when you start putting nutrients in the system, or it's some kind of thing they're allergic to, or whatever you're looking for to find and identify a problem, how much pressure you have to meet with her, excuse me, to find out what kind of problem you have here with the system. I'm going to demonstrate this again. I'm going to ask her to make sure her shoulder's straight, lock her elbow again, take the flat of my hand, push it against the top of her wrist, and ask her to meet my resistance. Ready? Resist. Good. And that's what her resistance is. That's what that feels like. So now I have a calibration. I calibrate how she is for me as I test her. Okay? Good. Now we're going to do our muscle testing procedure seated, because this is going to happen to you as well. Again, the more proficient we are with this, again, the more likelihood, again, we can find a problem in the system and correct that problem. So again, we're going to do our 2 pounds of pressure for 2 seconds for 2 inches. So again, seated, now the patient again sit up straight if they would, drop their shoulder, straighten your elbow. We push the flat of our hand on the flat of their wrist for 2 pounds, 2 seconds, 2 inches. And we have the person meet my resistance. And ask her to push. Good, thank you. So now I have a sensing about how much I have to push to actually break this muscle down. So now I've kind of calibrated her again, and so I know what kind of resistance she can take from me. And we're trying that one more time. Good. Drop shoulder, elbow straight, and push flat on her wrist. And resist, resistance. Good, thank you. Okay, and that's our seated position. Okay, now we're going to test, the last way we're going to test muscles, we're doing a laying position. Again, in the same way we did before. We were 2 pounds of pressure, 2 seconds, 2 inches. So again, as we do that, I ask the patient again to make sure we drop their shoulder, lock their elbow, and push flat against the wrist, and ask her to meet my resistance for 2 pounds of pressure for 2 seconds, 2 inches. Resist. Good. Thank you. So again, now we know what kind of resistance she has. So I know I've calibrated her. So I have some sense of what, if I put something on her system she has allergic reaction to or weakness toward, we'll find that weakness real quickly. And same reverse of that, if we find something that helps her and we put the right substance on her system, it will respond in a positive way, we'll get our strength back again. Remember again, the importance of all this is to have a stabilized point and something we can work from that's always stable for us. So your job as a practitioner is to make sure that patient complies with what you ask them to do. Sometimes we'll see these kinds of things happen. They'll roll their shoulder up. They'll actually pick their whole body up. They'll bend their elbow. They'll do those kinds of things not to give you a hard time, but just because they're trying to get strength for you again. But because this is your show, you're going to make sure they do it the way you choose to have it done. So we want to make sure that shoulder is dropped, that elbow is locked again, and when they push straight back for us. Again, meet resistance. Thank you. Okay? So once you've done that, and you have that stable point, now you have something to work with. This is your foundation. You work from here, all kinds of things, and wonderful things are going to happen because you become a good muscle tester. So work at it. Okay.